Hi, I'm Rod Brohard, your guide to first aid at About.com. Minor cuts and abrasions can be treated easily right at home. You will simply need soap, water, and an adhesive bandage. Depending on the circumstances, you may also want antiseptic ointment. At first, a little bleeding is a good thing. As blood oozes from the cut, it flushes out dirt and other contaminants. Encourage the bleeding for a few seconds. If bleeding is bright red or spurting, or if the cut is a deep puncture to the head, neck, chest, abdomen, back, or pelvis, call 911 and apply pressure with a gauze or a cloth to stop the bleeding. Elevate the cut above the heart. For minor cuts, rinse the wound under running water for a couple of minutes to flush dirt or debris out of the cut. Nothing special is needed here. Plain water works perfectly fine. Once the cut is rinsed, wash the skin around the cut with soap and warm water. Soap getting into the cut won't damage the skin, but it does dry out the wound a bit and it can sting. Larger particles that don't rinse away can be removed with a pair of tweezers. Do not use hydrogen peroxide. There's no need, and hydrogen peroxide might actually damage the skin. Only cover a cut if it's likely to come in contact with clothing or dirt. Cuts and abrasions left uncovered will heal just fine. The trick is to keep the wound clean. If the edges of a cut cannot easily be pulled together, or if you can see layers of skin on the walls of a deep cut, you may need stitches. Antiseptic ointment is optional, but can be used if the cut is going to be covered. Always put ointment on a cotton ball or a clean tissue before applying it to the wound. Applying ointment directly from the container contaminates the container for future use. An adhesive bandage is the best option for covering most cuts. Pull the plastic from one side of the bandage, position it so the pad covers the wound. Pull the other side of the plastic off the bandage and roll it over the wound gently. Don't put it on too tight, just enough to completely cover the wound. Seek medical attention for deep wounds if it has been more than 5 years since the victim's had a tetanus shot, if it's a laceration with jagged edges or won't close easily, if the wound is numb, if the wound is inflamed, swelling and redness around it, if the wound is draining pus, thick, yellowish liquid. Don't be afraid to call 911 if you believe this is an emergency, and don't be afraid to call your doctor or go to the emergency room if you're just not sure. For more information, visit us on the web at firstaid.about.com.